So we'll start off by looking at another example. We talked about a respiratory acidosis. Now let's do another blood gas example. We have a 7.1 pH. Anything less than 7.4 is an acidosis. So this is a acidosis. Now we got to label which kind of acidosis we're looking at. We have our respiratory component. Our PaCO2 is less than 40. If I start to hyperventilate, it means that I'm going to blow off extra carbon dioxide. So this patient is theoretically breathing a little more than their average, which a PaCO2 of 40 is normal. We have an oxygen greater than 100, so we are on supplemental oxygen. And we also notice that our bicarbonate is very low at 11. If our normal is 24, and 11 is a very low bicarbonate. So if our respiratory component, if we're actually trying to hyperventilate or overbreathe, this is going to be compensating a little bit. And we have a metabolic component here, which is contributing. So this example is going to be a metabolic acidosis. With a metabolic acidosis, we are going to have a pH that is less than 7.4 and a bicarbonate that is less than 24. Now if we were interpreting base excess, I said don't worry about it. Here our base excess would be negative great numbers, so like negative 13 for example for our base excess. In base excess, we don't have an excess, we have a deficit. So a base excess of minus 13 would indicate that our bicarbonate is very low. Now I think this is an important point to talk about another important concept. It's called Winter's formula. So Winter's formula is used with a respiratory acidosis state, and I do this one in clinical practice. Now Winter's formula is going to give you a predicted PaCO2 for a metabolic acidosis. Now, how you calculate this is going to be 1.5 times your bicarb. So in this example, 11, because I'm pulling my bicarbonate from right here. So 1.5 times your bicarb, and I'm actually going to HCO3 plus 8. Now there is a little bit of wiggle room on either side, so it might be plus or minus 2. Realistically though, you'll have a fairly good idea if you're compensating. Now what does Winter's formula tell you? Winter's formula is going to tell you if your PaCO2 is within the realm of compensating for this metabolic acidosis. Remember the lungs and the kidneys are two separate organ systems. Now if your kidneys are struggling to absorb bicarb, if you have a metabolic component to this, or there's other components that can lead to a metabolic acidosis, not just renal issues, but renal issues is one of the issues. You got to figure out, are your lungs compensating? The body always wants to operate at this 7.4 pH. Now the real question is, can they compensate? And here I can tell you the answer is no, but let's run through this. Here's Winter's formula. We have a predicted PaCO2. We can input numbers. This is going to be 11 plus 8. That's going to give me, sorry, I'm going to cheat here with the calculator. Plus 8, 24. So here, based on this parameters, my predicted PaCO2 is 24. Now notice how my actual PaCO2 is 39. 24 and 39 are not even close. You know, there's a little bit of wiggle room here, plus minus 2. These are not even close. Now what it tells me is we have a ventilated patient in the ICU, meaning that we are doing the controlled breathing for this patient, and we are doing a very poor job. If they have a metabolic acidosis, the lungs have to pick up the slack. So what I would do is I would either increase the respiratory rate or tidal volume for this patient to try and compensate, to try and blow off more carbon dioxide, to have a more accurate predicted PaCO2. So in this example, they're still in a very profound acidotic state. 7.1 is starting to be on more of the extreme end. Notice how my predicted PaCO2 of 24 is nowhere even close to my actual PaCO2, which tells me that I need to adjust some ventilator management. I need to adjust some settings to try and increase the minute ventilation for this patient so the lungs compensate. Hopefully that makes sense. Please comment if you have any questions.